All right, I have just two more issues that I just want to touch on quickly. The first issue came up in the previous lab when I was centering the age variable, right? Um, and you will also see that problem in the, sorry, this should be lab 3A. So in the lab 3A, you will see one of the measurement of blood pressure was 0. I'm not a clinician, but what does blood pressure measurement equal to 0 mean? Anybody knows here? So, I mean, having no pressure is something that is probably not explaining too much in my model. So in my lab, what I have done, I have deleted that 0 pressure. But if you have some clinical evidence to support that 0 is okay as a measurement, you can keep that in your model. But generally speaking, what I wanted to say about this diastolic blood pressure is that the normal diastolic blood pressure equal to 80 means it is normal, say for example. In that case, having a 0 diastolic blood pressure, like how do you really interpret that? So if you have 0 to 1, then your beta coefficient changes in this way. So how do you really interpret that kind of beta coefficient? So to have a clinical interpretation of your beta coefficient, it is very important for you to scale the measurement. And in that case, what you do is that you make this 80 equal to 0, right? So your measurement starts at 80, and then the beta coefficient that you are saying is based on from 0 to 1. When the beta coefficient goes on, what is the increase in your outcome? So you can interpret that, but the value based between like 0 to 80, there are not much value anyway, and those are highly unusual values even if they can exist. So how do you really interpret that? So that is the main idea of centering. So whenever you are dealing with say for example older age group, your entire population that you are dealing with is older age group where the smallest age could be 60. In that age, if you are saying, if you're not centering, you are saying that 0 has a meaning in the interpretation of your beta coefficient, but clinically it does not. So in those kind of scenarios, centering is very important. And obviously there are some statistical reasons for centering as well, such as reduction of multicollinearity and things like that. The other issue is scaling. The scaling issue is very important in the sense that you need to have your measurement in the context of changing your outcome. Remember, your beta coefficient is interpreted always as 1 unit change in your X is going to have that much unit or beta unit change in your outcome. So if you are dealing with a chronic disease such as, say, multiple sclerosis, where patient can suffer for, say, 50 years, then 1 unit change in your age is impacting 0.0003 unit change in your outcome. What does that really mean, and how does, like, that has less meaning, I guess. So in that sense, if you simply do the scaling in 10 years, maybe that kind of interpretation will jive better. And you can obviously read more about this in this reference.